Welcome to the University of California, San Francisco Sports Medicine Podcast, featuring Dr. Nira Fundia, Dr. Brian Feeley, and Dr. Drew Lansdown, discussing hot topics in sports medicine and society. We hope you enjoy our podcast and look forward to hearing from you.
All right, welcome to this week's 6 to 8 Weeks. I'm Brian Feeley. I'm joined by Drew Lansdown, one of my colleagues at UCSF Sports Medicine. Today we have the pleasure to have Justin Krogue, who's one of our prior residents who took what we would call a non-traditional pathway past his residency, and he has done a career, or he started a career doing both sports medicine, general orthopedic surgery, and also artificial intelligence and natural language processing. And he took an internship working for Google to kind of look at that interaction between how computers and healthcare can work. So welcome, Justin.
Thank you. It's good to be here.
So first of all, can you describe a little bit about your pathway, where obviously you trained with us, but what made you start thinking about trying to do this? Did you have a background in computer science? And then at what point did you decide that it would be a good idea to transition to a straight through, get a job pathway?
Sure. Yeah, so my path to Google actually starts a long time ago. I have, my family was big on trying to keep journals as a child. I feel like I never really did that, but I do have a single entry from when I was like 13 or 14 that says I either want to be a doctor or a computer programmer. So from a very early age, I was interested in both medicine and technology. As I got older, those interests continued. So I remember in college, I actually really enjoyed medicine and was thinking strongly about medicine, but also did a minor in computer science. I worked as a programmer at that time, just for like a local organization there at the college I was at. And actually thought about doing that, but really felt I was missing the impact that you had, or I thought you would have in medicine, which is a big reason that I continued the journey into medicine as opposed to just a computer science career. But I enjoyed the problem solving, the building that you do with computer science, where you have a problem, right? And then within a couple of days, you can get the solution that works and is quite satisfying to do. But again, didn't have the impact that you might have helping other people. So went to medical school at Washington, St. Louis. There had a pretty traditional time. Did have a moment in my third year of medical school where a fellow classmate had an idea for a kind of med tech startup type thing. He had this concept for essentially a media sharing service for surgeons to share securely videos and other surgical media with each other. And so we worked on that for a little while, for a few months, ended up dying, but really didn't have any big thoughts that there would be, a large part of my career that would be technology. Just thought that was kind of something separate and siloed at that time. I came out here to UCSF for orthopedic surgery, did not come to San Francisco because of, its background in technology. Came here because I'd done an away rotation and I loved people like Dr. Feeley and Dr. Lansdown here. But when I got here, was obviously injected into the scene and technology and things happening around, began to be a little bit interested in ways in which I could combine those previous interests I'd had both in medicine and technology. And then it was in my third year of being a resident where I really was turned on to machine learning and saw what was happening with machine learning and AI, specifically in medicine, and saw this is a way that people are starting to really think about using technology to make change and improve healthcare, and saw that as a really interesting and unique way, perhaps, to combine these two interests I had for a long time. So that's a busy time of residency for sure. Your third year as an orthopedic resident, you're still a junior resident, you're still taking in-house call. You're very busy, but did what I could to begin to kind of get involved in that space. So I did some self-directed learning, did some courses on machine learning and deep learning, learned some of the, I had a previous programming experience, but nothing in Python and the different frameworks that you use for these particular tools. And so I learned those frameworks, started doing some research in orthopedic surgery using AI for computer vision type stuff and radiology, and then did some consulting as well. And as I did that, I really, really enjoyed it and saw that my interest, not only was it fun to be in technology, but also my passion and interest for medicine was enhanced by this kind of stuff. I found myself thinking about orthopedics and medicine in new and interesting ways, and really found my love of what I was doing enhanced in all ways. So was really, really interested in making something out of that, but didn't know what that meant and didn't have a lot of mentors to look to, or at least direct mentors, I thought. Certainly there are people in orthopedics who are involved in different things. There's a number of, biomedical engineers, for example, who work with device companies to help, create different implants and things like that, but not as many who are in, medical technology, right, and computer science. And so I felt like I was a little bit on my own and was kind of charting this course. And really what helped kind of cement my final path towards Google is when I took the advice of my wife and just went and talked to Dr. Vale, who's our chairman here, and just asked his advice. And I was surprised that he was super supportive. He, instead of thinking this was some weird thing that was heretical and kind of outside the norm of medicine, he thought it was great, and he thought it would be an important area of innovation in medicine and orthopedics in specific. And he thought working in that space would not, it would be unusual, it would not be a bad thing. It would actually be something that would enhance the field. So he's super supportive, which I was surprised by. And that was kind of universally the case with the mentors I talked to at UCSF. Actually, they had the vision to see that even though this was different, this was not bad and was something that would complement a career in medicine. So with that, I continued kind of to do the work that I've been doing and research and consulting. And then I came across an opportunity that existed to do what's called like an AI residency at Google, where you can go and specifically work on healthcare problems in AI. And it's designed for people like myself who are physicians or otherwise in healthcare who have some experience but want more experience working on machine learning problems and learning how to apply those to medicine. So I guess, I can't get enough of residency, so I decided to apply to that program. Got in, and that's what I started right after finishing my surgical residency in the summer of 2020.
Nice. And Justin, maybe for those who don't have much background, can you explain what artificial intelligence, natural language processing, some of these like terms, like how do you describe those to most people,
including me?
Yeah. Give us some insight on this. Yeah.
So our artificial intelligence is a very general term. And really what artificial intelligence means is the attempt to try to do things that humans do by artificial means or by a computer, right? So that could mean, and this tends to move over time, right? As we become more sophisticated in technology, we think of artificial intelligence perhaps in more complex ways than was previously thought. So as an example of that, as when computing was new, we thought of the simple task of computation as being artificial intelligence. So, taking numbers and multiplying them together automatically with a calculator was something humans did, right? And so that was a tool of artificial intelligence. Now we think of that as something super simple. It doesn't require intelligence, so it's not necessarily in that domain. But that just kind of makes the case, right? That artificial intelligence is this very broad effort and field to automate things that humans do well. And it doesn't have a precise definition. So it's kind of a big umbrella term. Machine learning is a specific subdomain of artificial intelligence. So, fits within that kind of larger umbrella. And what machine learning is the effort to help machines learn from data automatically. So you're essentially, you're approaching artificial intelligence, trying to solve things humans do, that typically humans do. But your approach in this setting is by feeding machines data and having algorithms that allow these machines to learn from this data without having to directly program it. So I think it's helpful to think of a counterexample. So to really kind of cement what that means. In the past, it was very common, these still do exist. One very common approach to artificial intelligence was known as like expert systems. And the idea of expert systems was if we just had enough rules encoded, right, into a system, we could make really intelligent decisions. We could solve human intelligence just by encoding rules. So in the past, for example, with natural language processing and things like that, what people would do is they would try to write up, you imagine like a decision tree, right? And in every single branch point, there's some rule. And if yes, go left, if right, if no, go right. And you try to really hard code those rules in place. And you can get a fair way down the path of artificial intelligence doing that. And there was a lot of success doing that in the 80s. but you're running the problems where you have a hard when you have a hard time explaining why humans do something, right? So that might work well for teaching a computer to play chess, perhaps, if you can kind of outline some general rules and the strategy that it might follow. But you might struggle to teach a computer, for example, how to read an X-ray. I can read an X-ray, I can look at an X-ray and tell you, what's there, but it's challenging for me to say what pixel 1 and pixel 2, pixel 3, pixel 4 mean, right? And to make rules based on how bright pixel 1 is versus pixel 1006, right? That's a very challenging thing. And so that's kind of the power of machine learning is, okay, we don't have to necessarily have the rules in place. We can have just data, feed it to the machine, have some algorithm by which it learns from this data automatically, and therefore avoid kind of this problem of having to explicitly specify how humans do it. And even if you could explicitly specify, the other problem is often, as we all can imagine, right, these rules aren't perfectly followed, right? So you may have, even if you couldn't specify how exactly you read an X-ray, well, we'd quickly come across examples where you break from that norm, if that makes sense. You make exceptions, and so those are really hard to encode. So that's kind of the power of machine learning. Deep learning is a field specifically within machine learning that has gained a lot of excitement recently, which is, I think, the thing most people think about when you're thinking about artificial intelligence in medicine and the excitement. And deep learning is a specific type of machine learning where the algorithm, or the model rather, that is used to make these predictions or do whatever learning you're trying to do is something called a neural network. And a neural network is just a specific type of machine learning model that has certain properties that allow it to learn very, very complex associations between inputs and outputs. So as mentioned, machine learning, you're learning associations from data automatically. And in the case of deep learning, you can learn very, very complex association. So it's great for things like computer vision, where you're trying to teach a computer how to read an image, which again, as mentioned, would be really hard to do on a rule basis. Deep learning can learn these very, very complex and hierarchical associations between, pixels, for example, and what an image is, or in the case of natural language processing, it can take, raw text, right, and tell you what exactly is being said in that raw text, which is a complex task. Right. So that's kind of the three big, I think, umbrella terms that are used in this space. Artificial intelligence is the big kind of umbrella bucket that includes both. And then you have machine learning as a subset of that. And then deep learning is a subset that fits within machine learning.
Yeah, I totally understand that now. It makes a lot of sense.
Right.
I'm curious, in the next 10 years, at least in healthcare and medicine, what do you see from a patient-facing side? What will computers practically allow physicians to do, and how will that help patient care?
That's a great question. So I think that there's a great quote from, I think his name is Roy Amara. He's an old Stanford computer scientist, and this is a quote I think from the 60s maybe, and he says, "We overestimate the impact of technology in the short term and underestimate its effect in the long run." And I think that's really accurate. You see that in technology overall. I think if you think about, I don't know the exact date when we started having GPS in consumer devices, but I would never have guessed that GPS would underpin just what it does in my life, right? When it came out, or when I first interfaced with GPS, I'm like, oh, this would be great to navigate maybe in cities I haven't been before, right? And now I use GPS in every single trip I take in my car. I use GPS when I'm on Strava, an athletic tracking device. I use GPS all the time, right? And I never could have guessed that. And I think I have a very similar feeling with machine learning and artificial intelligence. So, as an aside, to answer your question, about 10 years ago, there was this big kind of revolution in deep learning where all of a sudden a deep learning based model surpassed what was being done by other machine learning models in computer vision. And this was a big moment, and kind of there had been a period of a couple of decades where deep learning had kind of fallen off the scene and was not thought to be necessarily the best method. And again, 10 years ago, 2012, this changed. Over the next couple of years, things moved really quickly. Until 2015, 16, these models were beginning to be better than humans were at certain specific tasks. So one of these is called ImageNet, where you're trying to just classify regular images as dogs or cats or whatever. And that's about the time that these models surpassed what humans could do, which, few years previous was just unthinkable. I mean, we were so far off of what humans could do. So anyway, there's a lot, I think at that time, all this excitement and excitement about machine learning and deep learning, but also a lot of fear, and especially in medicine, that, oh, wow, this is going to overtake everything, right? And that physicians are going to be replaced, radiologists are going to be replaced. And that hasn't really played out. I mean, we're now, 7 years past 2015, right? And what is, this stuff doing in computer science? And so I think this quote kind of really plays into this question in this space. I think what we're seeing right now already is machine learning beginning to underpin a lot of things that you do silently in the background. You're seeing things like electronic medical record manufacturers, for example, create machine learning based tools, right, to help detect things like sepsis and problems in ICU patients and give you prompts. You're seeing things like natural language processing, and these same electronic medical record manufacturers begin to process notes more smartly, perhaps, and suggest things to order, things you might do based on what you've written, right, in your assessment and plan. We're beginning to see some image-based tools that provide assistance to radiologists to help make diagnosis. For example, a previous project we did here at UCSF was detecting hip fracture. And we're currently in the process of implementing that into the clinical setting so that this algorithm will run silently in the background. And when it detects a hip fracture from an x-ray that was just taken, it can surface this to the radiologist more quickly so that they get to this image quickly, right, and avoid the couple-hour wait it might take for them to typically get to that x-ray. So I think in the next 5-10 years, what we're going to begin to see, again, it's not going to be, I think it is really exciting. I'm very bullish, obviously, on this space, but it's not going to be a takeover of medicine by technology, at least in an overt sense. But what you're going to see is in more and more areas, almost somewhat silently, I think, you're going to begin to feel the impact of artificial intelligence and deep learning in specific begin to kind of underpin a lot of what we do and support and augment, I think, the decision-making processes that we go through as doctors. And hopefully a lot of that will be tools that will make our life easier and better and help automate some of the maybe more boring things that we do, drawing angles on x-rays, for example, and things like that. Hopefully begin the job of the machine.
And so I agree. I think there's a lot of potential, a lot of excitement. What do you think is not in the future? Like what is too fantastical or just not feasible with what we're seeing at this point?
Yeah, I think I alluded to this a little bit in my previous answer, where I think that there was a lot of excitement, but also fear that we were going to be replacing doctors, right? And how secure is my future? And I think we are just so far away from anything like that. I mean, I would have no concern telling even my 8-year-old son, do whatever you want. At least in medicine and as a physician, I think it'll be pretty secure. I think that complex decision making is something that humans are really, really good at, and machines are still very much kind of infants at this stage, right? We get all excited because some algorithm can perform as well as a human. Well, that's great, but that's one particular diagnosis that algorithm can make, right? And at this point, if you wanted to detect all of the different things that you maybe could as a pathologist, or as a radiologist, for example, maybe they have 1,000 or 10,000 diagnoses in their brain they can use. But that's going to take a long time to individually train, right? All those different models to detect each of those different things, right? And then to run each image through all of those different models to get those predictions, and then somehow sum those together. It's just something that we're just not there. We're not even really close to being there, if that makes sense. So I think what's not the future are these kind of is a broad takeover by machines or a need to fear the machines. I think what you're going to see is specific use cases and support in those use cases for existing providers and physicians. And I think things will change. Obviously, your workflow may change. There may be some areas in which your life is easier because of this, and you have to do less work in this particular thing. But in terms of it replacing any kind of given specialty, I think that is not, at least in the immediate future. I think that's something still for the science fiction movies.
Yeah, I think that's a really good point, that it takes potentially years for a computer to learn how to read different hip x-rays, but it also takes humans years to read different hip x-rays. But during that time, we're also learning how to read pelvis x-rays, knee x-rays, et cetera, MRIs and CTs. So the back end amount of work that goes into putting efforts into computer programming to design these makes it really complicated and makes you sort of appreciate how hard it is for humans to learn all this stuff. I always find it interesting when patients say that, well, I really want the robot to do my total hip or total knee or total shoulder. And the reality is I think the way you put it is really nice. It's a nice augmentation of human capabilities. It's not going to necessarily replace it. And that's a lot of what the computers do in the intraoperative setting. They end up making our cuts a little bit more precise. They really get rid of the statistical errors and doing a big mistake. We have one final question, which I think is really important today. We talked a little bit about AI and machine learning. Given the news yesterday, is Tom Brady a robot?
I actually missed the news. What was the news yesterday? Is he coming back?
Yeah, he's coming back to Tampa Bay. I think he saw his 401k drop and gas prices, and he said, one more year sounds about right.
Short retirement.
At some point, maybe we need to set an age. At some point, if he's still playing at the level he's playing, we've got to be suspicious that there's a great quote, right? What is it? When you've excluded the probable, the unprobable is likely. So, at some point, if he keeps playing at this level, then you've got to consider he may be a robot for sure.
Yeah, I think he is. Well, thank you very much for joining us today. Hopefully that was informative for everybody who listens, and we'll see you soon next week.